seen the SNAP program began out of politics in the 1930s during the Great Depression, at a time when farms were going out of business and people were hungry, or as Janet Poppy said in her quite extraordinary history book of this period, bread lines knee deep in wheat. To solve that problem, the government had the idea of developing a food stamp program with very important humanitarian goals. One, to deal with food security of individuals, and the other to deal with the livelihoods of farmers, which at that time were all small farmers. In 1939, the first food stamp program was developed, and it lasted until 1943. It raised the issue immediately of what foods were eligible. It allowed orange stamps to be used for any food except for beer, wine, and liquor, items eaten on the premises, and in 1941 it added soft drinks to that list. So there's a long history of soft drinks being excluded. For every dollar that people bought in orange stamps, they got another 50 cents in blue stamps, and those could be used on any USDA surplus food, and those surplus foods varied from what we would consider to be healthy to those that we would consider to be less healthy, but they were basically real foods at the time. In World War II, the need for the program declined, and there weren't any leftover commodities anyway. But by 1961, the country needed there were a lot of poor people around, and there was a pilot program that lasted for a few years. And in 1964, the Food Stamp Act was passed by Congress with having as ineligible foods, alcohol, tobacco, and certain imported foods. An amendment to try to exclude soft drinks and certain luxury fresh and frozen foods was defeated. But again, it introduced the idea that some foods were eligible and some foods were not. The Food Stamp Act was not particularly easy to pass. It was embroiled in politics, in very difficult politics. And this was one of the places where President Lyndon Johnson brokered a deal between farm state Republicans and Southern Democrats who wanted farm supports, agricultural supports, particularly for large farmers, and urban Democrats who were worried about the need to help the poor people in their population. And they brokered a deal in which urban Democrats would vote for farm supports if the farm state Republicans and Southern Democrats would vote for food stamps. And that's what happened, and there was a log roll deal that passed that act. The log roll was an uncomfortable one, and there were a lot of problems with it, and the politicians decided in the 1973 Farm Bill that the deal would work much better if they were both folded into the same bill. And so the 1973 Farm Bill amended the 1964 Act in certain ways, and in 1977 the food stamps were entirely incorporated into the Farm Bill, which as Title 13 had the Food Stamp Act of 1977 incorporated into it. What was particularly interesting to me about that action was that there was a policy that was in Title 13, and the policy was, it was the policy of Congress in order to promote the general welfare, to safeguard the health and well-being of the nation's population by raising levels of nutrition among low-income households. It would be nice to see statements like that in today's Farm Bill. Things ticked along until 2008, when the 2008 Farm Bill changed the name of the food stamp program to the Supplemental Nutrition Assistance Program, and they gave 3 reasons for doing that: because of the program's focus on nutrition, because people were using EBT cards, not food stamps, and to help reduce the stigma that was associated with use of food stamps in stores. The situation has changed in the food stamp program from that history for 2 reasons. One is the sharp increase in the number of people receiving food stamps, particularly over the last 5 years, and almost doubling due to the problems in the economy. And the other, as you've heard, is the enormous increase in the number of obese people over the last 30 years, particularly among the poor, and particularly among users of food stamps. And this has changed the politics of the situation. From the standpoint of the numbers of people involved in it, it has focused attention on the enormous disproportion of funding for the Farm Bill that goes for they're still calling it food stamps in these things, but that goes for the SNAP program. Although commodities, crop insurance and conservation, the part of the Farm Bill that actually supports farms, accounts for $20 billion a year, that $20 billion is completely swamped by the $82 billion that is estimated to be spent on SNAP in 2013. So that's one of the reasons why the SNAP program has come under such sharp scrutiny from the budget cutters in Congress. The effect of obesity has been to change the way the government advises people to eat. And the Department of Agriculture's food guideline plate has as its kind of first precept make half your plate fruits and vegetables, which is something that the Farm Bill does almost nothing about. It does some, but not very much. And that has induced a large number of groups to start arguing that we need to bring agricultural policy in line with health policy, and agricultural policy includes SNAP, because SNAP is in the Farm Bill. So that various organizations have published reports and books about how to align agricultural policy with health policy, with SNAP being a very important part of that alignment. So that brings us to the question of eligible foods. The current guidelines are that EBT payments cannot be used for beer, wine, or liquor, food eaten in the store, or hot foods. They can be used for fresh foods, for seeds and food plants, and for processed foods, soda, snacks, and candy, thereby raising great questions about their use. The Department of Agriculture, recognizing the kinds of contradictions involved in this policy, has over the years produced several reports that are relevant to this issue. Food stamps and obesity. Is this an ironic twist or a complex puzzle? Can food stamps do more to improve food choices? And Department of Agriculture economists have come out with several ideas about what could be done. One of them, price strategies, another is vouchers, and then also to examine the eligibility of certain food items. The price issue is a particularly important one. We've heard about this already. If you look at the index price of fresh fruits and vegetables from 1980 to the present time, just exactly the period in which the prevalence of obesity increased so rapidly, the index price of fresh fruits and vegetables has gone up by about 40%, whereas the index price of beer, butter, and sodas in this slide has gone down by 15 to 30%, meaning that if poor people perceive fresh fruits and vegetables as being expensive, it's because they are expensive. And that brings me to the whole question of the processed foods. And Michelle Simon's report that came out just last month, Are Corporations Profiting from Hungry Americans? Michelle is here today. Michelle, where are you? There you are. She has several copies of the report available, so swamp her afterwards for them. In her report, which is really well worth reading, she has a couple of things that I found particularly interesting. One was big food federal lobbying in 2011, in which she lists a whole group of food manufacturers and trade associations, all of which are spending a great deal of money lobbying on SNAP issues. And much of that lobbying is directed towards making sure that food choice is preserved in the SNAP program. She also points out that at least in one survey, Walmart received half of all of the SNAP dollars spent in Oklahoma, and there are a whole list of Oklahoma stores that receive millions and millions of dollars every year from SNAP recipients, and which is part of the reason why Big Food is so interested in making sure that the choice stays there. The issue came up, as has been mentioned earlier this afternoon, about media advertising. Advertising Age every year in June, everybody should know this is very useful, publishes a lot of data on the advertising that goes through advertising agencies. So this is just media advertising that goes through advertising agencies. It doesn't include advertising that doesn't go through advertising agency, but it amounted to $16 billion in 2011. And I've given here some of the figures on individual media expenditures for specific products. $267 million a year for Coca-Cola, $113 million for Gatorade, $42 million for Frosted Flakes, and so forth. Compare those numbers. Coca-Cola, Gatorade, and Frosted Flakes together take up the entire SNAP ed budget. If Susan Forster's figure is correct. So it doesn't take much to realize how outflanked SNAP ed is. Much of that money on food advertising is spent in low-income communities, and there's increasing evidence that a disproportionate amount of food advertising dollars for those kinds of foods are spent in low-income communities. And these are a couple of recent reports that detail some of that. So there's a direct effort made to sell these kinds of programs. And as Susan mentioned, there are stores in low-income communities that advertise that they accept EBT benefits, and usually Coca-Cola, in this case Red Bull and Coca-Cola, are on these signs. Food trade associations have partnered with anti-hunger advocates and this happened about a year ago, and they wrote a coalition letter to urge Congress to oppose program changes that would limit consumer food choice. The efforts, they said, should focus on nutritional education, access, and outreach. We've already talked about the inability of nutritional education to reach these people, and access and outreach also are not likely to be effective. And it's, although this seems like an uncomfortable alliance, the food trade associations fund many of these anti-hunger organizations. I want to give an example of the way this works in progress. Michelle Obama, as part of her extraordinary Let's Move campaign, which is doing so much to try to change the national conversation about childhood obesity, has gotten a lot of retail organizations to work with her, and one of them is Walgreens. And at a press conference in Chicago, the head of Walgreens explained that Walgreens stores were uniquely positioned to bring more food options to Americans. Well, that brought me to my local Walgreens, in which we accept SNAP cards in English and Spanish, are on all of the frozen and fresh and refrigerated food cases for sodas, ice cream, and Red Bull. The Saligal case that contained fresh food did not have an EBT sign on it, and I thought that was worth a conversation with the manager. So I asked the manager, how come? And the manager said that the signs were there to inform EBT users that those products were available to them if they wanted to spend their EBT dollars on that. And that there was no point in putting the sign on fresh fruit and vegetables because EBT users already knew that they could spend their dollars on that. And besides, he said it's very expensive to run these stores in low-income communities, and our profit margins are much higher on the processed foods. So that's looks to me like a place where a little intervention might be helpful. There are any number of programs, and you just heard about some of them in New York City. There are some that are national that encourage EBT users to spend their money on foods, on seeds and food plants, to double their dollars. And the groups that are working on some of these groups are public and some are private. These are very, very small pilot interventions that are not very well funded in comparison to food industry marketing, and that are not reaching very many people. So at this point, they're not really a countering force in education and outreach, and much, much more would need to be done to make them a countering force. So I want to go back to the humanitarian goals that this program started with and remind everybody that The purpose of this program is to improve nutrition and to safeguard health. Safeguarding health these days means doing something about obesity as well as food insecurity, and that 50% of the recipients of SNAP benefits are children who are innocent in all of this. So there were, if I estimate correctly, there are 23 million children in SNAP families. They represent our nation's future, and it is in our national interest as well as our humanitarian interest to make sure that those children are food secure, are well nourished, and are healthy. Thank you.